Again with the good microphone on. Yeah, see if this is any better. So this is an update. I was just made aware of this paper which has just come out, and it is about what happens to the human heart after COVID-19. And it's the biggest study that I've seen that's looking at adult hearts, although I know there are several other studies that are out there at the moment that seem to be related to different aspects of how the heart functions. The interesting or worrying thing here is they've got a decent sample size. So they got 100 different patients, and of those patients, they're looking for a couple of things. So they're doing the MRI on their hearts, and they're looking at how much blood is the heart pushing, which is effectively a measure of how strong is the heart, how well is it doing at its one job, which is to keep things moving in your bloodstream. And the other thing that they look at is they're looking for evidence of inflammation in the heart. Inflammation is going to be some kind of immune response, and this could be as a result of damage or potentially ongoing infection, although these are all people that are virus negative. And so they've been done with the actual illness for a while. And so the findings in here, I think, are all just contained up in here, but you're going to want to look down. There's a slightly more detailed version right here, and then the really detailed version is coming up right down in this section. So that's where you want to start. First of all, who are the people in the study? About 2/3 of them are people that got COVID and were able to recover at home. So they were not severe patients. They would either be called mild or asymptomatic. The remaining 1/3 of patients were people that were in the hospital at least for some amount of time. The really worrying thing from this paper, actually there are several. One is that 78%, 78 out of the 100 people actually showed some kind of heart damage or either ongoing heart inflammation or unusually low heart function, and compared to people who had not had COVID-19. And this was not related to the severity of the disease. So they found just as much severe heart disease, COVID-induced heart disease, in people who had had mild COVID and severe COVID. So that's somewhat worrying. And the other thing is that it was not dependent on the time. So you might imagine a situation where the virus would be in there, it would cause some short-term damage to the heart, things would repair, and then you could get on with your life and you'd probably be back good as new. If this study is borne out in ongoing larger studies, it suggests that this damage is actually permanent, because they showed no relationship between the amount of time since a person had gotten over the symptoms of COVID and the amount of damage that was remaining. So that's bad. We're looking at a case of permanent heart damage that may not be repairable. It's still too early in this, I guess, to say whether, at some point for more months or years down the road, there might be some way that the body repairs some of this damage. The body's great at doing stuff like that, but from the information that we have in this study, and I've seen a couple other recent studies where doctors are specifically looking at the heart and exactly what's going on in the heart in people who have recovered, the information from these is not good and points to very severe effects of even mild COVID. The other thing to point out is the average age of people in this study was, I think the median was between 45 and 50, and it was about half men and women. It's a good little cross-section of the population. And so this is, I expect, I don't want, but I expect to hear more studies like this coming out in the future. In general, as we've been learning more things about the virus, the things that we're learning tend to be pretty serious and pretty bad. And yeah, I think this ought to be part of the conversation. If people are having conversations about COVID, this is worth being able to bring up yeah, at least to be something that is on our radar that we're all thinking about. And so I figured people are probably going to want to have a look at this themselves. Here's the paper up here. Here's the link if you want to go to that. Just pause the video. And I think that's all I've got to say about it now. I'm going to give it another read when I get back to the hotel tonight and see what else is in here that can be picked out and, sort of kept in mind. So for now, thanks very much. And yeah, I hope you have a safe and very nice day. This has been Ask Dr. Ben, and this was an update.